biolearnica. I am Tushar Visnagra and today we are going to talk about UMN and LMN. That is the difference between upper motor neuron and lower motor neuron. So just let's dive into it. In today's video we are going to talk about the introduction, common causes of the lesions, differences between the lesions and overall summary. So firstly the introduction. The upper motor neuron are actually present in the brain or brainstem near the primary motor cortex, and it has two tracts, the corticospinal tract and the corticobulbar tract. Okay, so the corticospinal tract actually descends downward and innervates the alpha and gamma motor neuron, which actually innervates the skeletal muscle. And the corticobulbar tract actually descends downward, and from there arises the cranial nuclei of the lower motor neuron, and from which the cranial nerves arises. So the lesions in the upper motor neuron leads to upper motor neuron lesions, and the lesions in the lower motor neuron leads to lower motor neuron lesions. So let's now talk about the common causes of lesions. Firstly, the upper motor neuron lesions usually occur due to various vascular accidents and also due to multiple sclerosis. And in multiple sclerosis, actually the upper motor neuron damages. And the most common cause of lower motor neuron lesion is the viral infection. So the viral infection caused due to the poliovirus causing the poliomyelitis disease. And also the infection caused due to West Nile virus. So talking about the differences between the lesions, firstly the mass. The upper motor neuron lesion actually causes the damage of the upper motor neuron, and thus all the muscle actions which are voluntary are lost, and thus the muscle is in the stage of disuse and causing the disuse atrophy. The mass also decreases little bit, which is 15 to 20% in upper motor neuron lesion. And in the case of lower motor neuron lesion, there actually occurs a damage of the lower motor neuron, and it actually secretes acetylcholine, which is a neurotransmitter. It actually has two functions. Firstly, in the muscle contraction, and second is the activation of the transcription factors, which actually make the mRNA and the muscle protein. So in this case, the muscle proteins are synthesized less. The protein synthesis is less and causing the proteolysis. So proteolysis, and thus mass severely decreases in lower motor neuron lesions around 70 to 80%, and causing the denervation atrophy in lower motor neuron lesion. Then talking about the fasciculations. So what are fasciculations? Fasciculations are actually the involuntary pathological muscular contractions. So it actually occurs only in lower motor neuron lesions. So this is a lower motor neuron, and it actually gets damaged in lower motor neuron lesion, and thus it secretes a neurotransmitter which is called as acetylcholine. It actually activates the nicotinic receptors and causes the sodium influx. So thus in this case the sodium influx is decreased. So actually the muscles think like that if their receptors are actually less, which is causing the less influx of sodium, so it increases the receptors and thus causing the sodium influx to increase, and then the resting membrane potential turns into traction potential, and then to the action potential, and then actually muscle contraction takes place. So this is actually the pathway causing the fasciculation. So actually small tap on the hand may also lead to a hypersensitive action by the lower motor neuron. So let's now talk about the tone, DTRs, and strength of the lesions. DTR is deep tendon reflexes. So firstly talking about the upper motor neuron lesions, the upper motor neuron actually gets damaged, and there comes a nuclei which is called as medullary reticulospinal nuclei, and actually the stimulatory fibers from the upper motor neuron are reached less, and causing the opposite action in the nuclei, and the nuclei actually stimulates the lower motor neuron over here, and causing the tone of the muscle to increase, and also the spindles of the muscles become sensitive and the stretch receptors are stimulated, causing the hyper reflection. Okay, so this is actually the reflex arc forming over here, and this causes the spasticity paralysis in the muscle. It is actually called as spasticity paralysis. Then the lower motor neuron lesion. In this, the lower motor neuron over here is damaged and causing the tone of the muscle to decrease, and the sensitivity of the muscle fibers also decreases, causing the stretch receptors to get stimulated less and causing the hyporeflection, and this causes the flaccid paralysis. Okay, so the in upper motor neuron lesions it was spasticity paralysis, and over here it is flaccid paralysis. Okay, then comes a special sign called as Babinski sign, which actually differentiates between the two lesions. And in this sign, pin-like thing is rubbed over the plantar surface of the foot in this direction. And if the fingers are in the state of flexion, it is actually negative Babinski sign, and this occurs in lower motor neuron lesion. And if the fingers on toe are in extension position, so it is actually the sign of upper motor neuron lesion. Okay, so then comes the summary. So let's just quickly revise all the points. So in the mass, the upper motor neuron lesion, the mass was decreasing up to 15 to 20%. In lower motor neuron lesion, it was actually severely decreasing about 70 to 80%. In related to strength, it was actually occurrence of the spasticity paralysis, and in lower motor neuron, it was flaccid paralysis. Talking about the tone, actually the tone in upper motor neuron lesion was actually increasing. It means hypertonia was occurring, and in lower motor neuron lesion it was decreasing, and thus it is called as hypotonia. The DTR, it means the deep tendon reflex, and they are actually increasing, means the hyperreflexia is occurring in upper motor neuron lesion, and hyporeflexia was occurring in lower motor neuron lesion. Talking about the fasciculations, so the fasciculations are occurring in lower motor neurons only, and they are absent in upper motor neuron. Okay, so fibrillations are actually the representation of the fasciculations in the graph-like structures. So here also it is absent, and in lower motor neuron they are present. Okay, so Babinski sign is actually negative in upper motor neuron, positive in upper motor neuron lesion and negative in lower motor neuron lesions. Okay, so this was the summary. Okay, so acknowledgement. Thank you.